Good morning and happy Monday, everyone. It is November 29th, 2021, and I hope everyone had a great Thanksgiving break. Dr. Bray, UTD EPPS professor and director of the Institute of Urban Policy Research, joins me for our COVID-19 trends, and we'll talk about the Omicron variant. Bring up the dashboard, Dr. Bray.
Great. Thanks, Dani. Hope you had a great Thanksgiving as well. Well, Dani, as you can see, our numbers continue to look good here in North Texas. You mentioned the Omicron variant. We'll get to that in a minute. To date, almost exclusively what's been seen in North Texas and then HHS Region 6, which is several states around us, is the Delta variant. This is the variant that was first discovered in October of 2020 and has kind of been the variant of concern in the United States. Our new cases in the last 7 days in North Texas are down 34%. From 5,864 to 3,822. And our deaths in the last 7 days are down. Active cases are down fairly decently as well. We're almost to 10,000 active cases, which in a region of 6, 7, 8 million people starts to look like a pretty good number. Hospital occupancy is holding steady. Again, our total occupancy remains kind of high, 85, 90%. But the COVID representation in those numbers is down, which means more people with other concerns are getting the care that they need. So that's the good news. We continue to wait to see if there's been any effect of the Thanksgiving holiday. So typically in 7 to 14 days, I would say 7 to 10 days from last Thursday, if we do start to see a surge or a spread, we won't see it for about a week. We'll start to see those numbers tick up. So fingers crossed that if everybody followed their precautions and was appropriately cautious with their loved ones, we should weather this holiday season fairly well.
Thank you so much, Dr. Bray. Can you speak to this new variant and how it may affect us in the future and what we can do about it right now, or do we need to be concerned even in general?
So always be concerned is, I think, a safe rule. So for those of you just waking up from the Thanksgiving stupor, on the 24th of November, doctors in South Africa identified a new strain of COVID. And they thought it was new because the symptoms weren't manifesting the same. So they had very few COVID infections in South Africa. All of a sudden, there was a new wave of infections. Doctors in South Africa say that the cases tend to be milder and are not requiring hospitalization, but they're much more contagious than they were before. So remember, we've discussed this before, the life cycle of a virus. Viruses evolve just like you and I do. Viruses, as they evolve, seek to find ways to spread faster and live longer. That generally means that viruses become more contagious over time and they become less lethal because viruses don't want to kill off their host. That seems to be what we're looking at here. The World Health Organization declared this as a variant of concern. They've named it Omicron is its designation. We still don't know much about scientifically the symptoms that we're seeing, the spread. We just know that from looking at the genome itself, it's highly mutated from what we've seen before. So I would suggest that we maintain vigilance, but I would not panic. And that's one of the things I think we need to be most cautious with, is not panicking. We don't know yet what this particular variant has in store. So all of our old precautions of masking around strangers, masking in public places, washing our hands, maintaining social distancing, all of those practices we've been practicing now for 18 months will continue to help us as we find out more about this variant as it's studied. But the sort of back of the napkin talk is it is much more contagious, but it is also much less serious. Doctors in South Africa are saying patients aren't even losing taste or smell. The main symptoms are several days of fatigue, much like you would see if you had a serious bout of influenza. So fingers crossed that we learn as much as possible before that variant is discovered here in the United States.
Thank you, Dr. Bray. And that was going to be my next question, is if it was discovered in the United States yet. And I think that answer is no, correct?
Yeah, that's right. We have not seen it yet in the United States. Now, again, we just discovered it 5 days ago. I wouldn't be surprised when the variant that they discovered in South Africa was from a blood sample that was drawn on the 9th of November, which means, it's had a good 2 weeks to sort of circulate before it came to our attention. I suspect we will find it in the United States. It's just a matter of time. And again, that's why it's so important to be vigilant now, even if we don't know if it's in our neighborhood yet.
Absolutely. Well, thank you so much, Dr. Bray, and we will see you all next week.
Thanks, Dani.